I'm Dr. Gamble. I'm going to be doing the presentation today. It's not what you might think it is. This is an excellent therapy. It's something that I'm certified to do, and I'm going to talk to you just a little bit about it to give you an idea of how it may or may not work for you or for a family member. Before we get started, I'm going to introduce the staff real quick. My practice manager, Mr. Jimmy, he's in blue today, representing very nicely, I would say. And then we also have Lanisha. She's one of our newest staff members. She works the front desk, kind of floats around. And then we have Penelope. She's been here the longest, and she is jack of all trades. She does a little bit of everything. If you talk to anyone on the phone here and get excellent service, you've probably been speaking to Penelope because she is Johnny on the spot. So what I'm going to do, I'm going to let them have a seat, and then we're going to get started. So as I am talking, guys, feel free to ask me questions. It does not bother me at all if you interrupt me, because like I said, it's not what you think it is. It's therapy, but it's not invasive therapy. And so that's why our top slide says that this is a non-surgical option to get rid of the use of glasses. And so when we look at that idea of getting rid of glasses and how could we possibly do that, we need to talk about terminology. So the name of the therapy is orthokeratology. Orthokeratology basically is a therapy that is used to reshape the cornea, which is the front part of the eye. And in reshaping the cornea, what that does is in certain prescriptions or certain refractive populations, it allows you to see during the day seamlessly clear without the use of glasses or contact lenses. And so the therapy, you use a rigid gas permeable lens. And if you guys think of like a soda bottle, how that hard plastic feels, that is the type of plastic that these lenses are made out of. But the lenses breathe very well. They're safe to use in your eyes at night. And when you put the lens in your eyes at night, like I've said already, they help to mold the cornea into a different shape so that you're able to see clearly without having any correction on. Paragon CRT lenses, you'll hear me say CRT, Paragon, CRT. That is the lens that is on the market that has been FDA approved since 2002 to treat patients who want their corneas shaped and molded. So those lenses are, like I said, FDA approved. They are used around the world. 1.3 million patients have used this lens. So this is not, it's new technology to maybe us here in Pembroke, but it is not new technology as far as the world goes. Millions of patients, like I said, have used it, and it's it's a hard lens that helps to get the eye into a new shape so that you can see clearly. It's safe for kids. I've had a couple of people outside of the office just kind of in preparation for today asking me, well, who can use it? And we're going to go into that in a little more detail. But kids as early as 8 years old can use these lenses. And we're going to talk about when that is indicated. Adults, of course, of all ages, if you meet the criteria, you can do the therapy. And then lastly, it's indicated for the treatment of myopia and astigmatism. So though I'd like to say, everybody come on board, let's do the CRT therapy for you, it is definitely a procedure that is best received on an eye that's myopic or nearsighted and an eye that has astigmatism, okay? So when we talk about the lenses, like I said, it's similar to the plastic that's on a soda bottle. They are shaped in a way that it resurfaces the middle part of the cornea. The cornea is the front dome cover of the eyeball. So when you look at this picture that's here, the front part of the eye before the optic nerve, which is the back part of the eye when we're looking at this picture, that cornea gets treated with the lens. And as the lens pushes onto the eye, it gives it a new shape. And once that shape is there, the cornea is very resilient in the sense that it is not damaged with ease, but it is also a structure that will give. And so once it's reshaped, it'll stay in that shape until the next morning, or the next day, the next evening, I should say. And so when you look at this, depending on how curvy the front of your eye is, that will determine how much of a prescription you have. So there are specific parameters, like I said, that have to be in place to make sure that you're a candidate for the condition or for the therapy. And we're going to talk about that here on this next slide. Maybe. If it slides. There we go. So how does Paragon CRT work? I have a little video that I'm going to flip screen so that you guys can see what the process is. But like I said already, the lenses, they go onto your eyes. You put them in at night. The lenses will hug very tightly to the front of your eyes. They're super comfortable. And as they're hugging to the eye, they kind of mold and they shape the cornea into that shape that's needed in order for you to see clearly. The way we determine what is needed is with a consultation. When you come in, I take measurements with a special device. Those measurements help me determine what lens to put in your eyes when you're sleeping at night, and the therapy then is activated. So give me a moment. I'm going to see if this will work, guys. Ignore the fun pictures that come up here. It's a little impromptu on the pictures. We'll be ignoring those in the live feed, I hope. But here's just a really short video.
Corneal refractive therapy is an exciting, new, and effective vision correction alternative. It features a uniquely designed contact lens called Paragon CRT that gently reshapes your cornea while you sleep. Paragon CRT makes it possible to enjoy great vision during the day without glasses, without contact lenses, and without surgery.
What is myopia?
So we're going to come back to this one in a second. So as you can see from the video, what happened was they put the contact lens on the eye, and with the pressure of the contact lens pushing on the eyeball, the cornea is reshaped. The young person sleeping in the video was sleeping without any hesitation. So the lenses are definitely comfortable. Let me go back to my slideshow here and show you guys the two conditions in a little more detail that work best for CRT therapy. So the two conditions, we've already talked about them, myopic eyes and astigmatic eyes. When we talk about a myopic eye is an eye that's too long. And when it's too long, the light rays tend to focus in front of the eyes. And so that's why images for patients who have nearsightedness or myopia are blurry, because the image wants to get to the retina, but it doesn't have enough ability to get there, and so images are blurry. With astigmatism, people always ask, well, Dr. Gamble, what is astigmatism? What does that mean? So the A in astigmatism means not, and stigmatism means that there are two curves. So the curves are not where they should be, which causes light rays to not focus in an appropriate point on the back of the eye. And so I'm going to show you two videos that kind of depict that a little bit better than what I'm illustrating here. So give me a moment again, and these are the last two videos, guys, I promise, where I'm going to have to do the little side screen thing here.
What is myopia? Myopia is an eye defect due to which the eye is not able to see distant objects clearly. This occurs when the light rays entering the eye converge in front of the retina in the vitreous body. Here you can see the formation of the image in a normal eye and in a myopic eye. In the case of a normal eye, the rays of light from the flower falls on the eye and converge on the retina, whereas in the case of a myopic eye, the light rays are focused in front of the retina. Myopia is caused due to elongation of the eyeball, decrease in the focal length of the eye lens. A concave lens is used to rectify this optic abnormality.
So does that make sense, guys? The light rays coming into the eyes do not come to an appropriate point, and because they don't come to an appropriate point on the retina, you have blurry images. And so what the lens does in essence, outside of just reshaping the cornea, it helps to move those light rays to an appropriate point onto the retina so that you're able to see with clarity. So now I'm going to show you a quick video on astigmatism. And this will go into just a brief synopsis of what astigmatism is.
So a common question I get almost on a daily basis is, what is astigmatism? Well, astigmatism is the most common refractive error in the world. In fact, more people have astigmatism than there are people that are either nearsighted or farsighted. So what in fact is it? It has to do with the shape of the eye. So let's say you have someone that has no astigmatism at all. Well, their cornea is actually perfectly round. So some patients may have been told, well, I have a basketball-shaped eye. Sometimes patients have been told they have a football-shaped eye. I like to use an analogy of an egg. So basically, if you have astigmatism, you have two different curvatures to mainly your cornea. What is the cornea? That's that clear surface. It's the window that sits over the colored part of your eye. So someone that has astigmatism, you have basically kind of a steep part to the eye, and then the other side, you have a flatter part to the eye. And that basically makes kind of two different surfaces, or two refractive surfaces, that makes the light at two different points behind the eye. So instead of having basically one power to your prescription in contacts or glasses, you actually have two. So again, like I have astigmatism, and you don't need to be worried about it because it is a very common thing. And what's most important is if you do have it, you do have it corrected in your glasses as well as possibly in your contact lenses.
Okay. So with astigmatism, very straightforward in the sense that what's going on is that you have two curves on the front of your eyes. Because of the two different curves on the front of your eyes, the contact lenses or glasses have to be created to take care of both curves of the eye. The Paragon CRT lens therapy can do that. The lenses have a set parameter of 1.75 units of astigmatism. And so what that means is if your prescription on the astigmatism part is at a level 250, you would not be considered a candidate. But sometimes even at that level of prescription, we can make the therapy work. So the reason I say that is that we don't turn anyone away. We will test you, we'll bring you in, we'll do the consultation and see if the therapy is right for you. On the nearsighted side of the spectrum, you need to have 6 units or less. So keep that in mind. If you're a level 10 nearsighted prescription, then that would not be a good candidate for this procedure. We would talk about different options. But if you're 6 and below on the nearsighted spectrum and 1.75 units or below on the astigmatism spectrum, then this is a therapy that might work for you. So let me move forward here and let's just talk about what to expect from orthokeratology. I know you guys are like, finally, to the good stuff, the meat. So what happens is we bring you in for the consultation. The consultation is free. That is just, hi, I'm Dr. Gamble. Tell me what your goals are. What are your thoughts in doing this therapy? Are you trying to come out of your glasses forever? Are you wanting to just have a weekend getaway where you want to be able to put these contact lenses, do treatment, and have clarity while you're on a date with your mate? We would talk about what your goals are as it pertains to the therapy. We would check to see if you're a candidate, because like I said, there are some parameters that unfortunately we just have to meet. If you're a candidate, then we would go ahead and get you scheduled for that next visit. The next visit can happen the next day because I have actually all the tools needed and required in order to do the fit in office. Some offices have to send out for the lenses and have to get specific kits per patient. You would not have to wait here. When you come in and we schedule the appointment, what you need is here on site. So when you're talking to your friends or even thinking about it for yourself, next day you can be starting this therapy. At that visit, we try the lenses. I will assess the fit. We do the training, which, you do have to be able to get the lenses into your eye. You are going to have to be able to get the lenses out of your eye so that you can have that clear, sharp vision. And then after we go through all of that, you leave with a smile. You leave with the lens in your eye. We typically try to do the fittings in the afternoon so that you can go home and go to sleep with the contact lens in your eye. The next day I do have to see you because I need to make sure that the therapy is on task. If you come back the next day and we assess the fit and there's something that's wrong, again, we have everything on site typically that's needed, and we can go ahead and get those things adjusted for you, get you into the updated lens, and then I would see you back for a follow-up in 2 weeks. Now, I would be remiss in not saying this, that you would leave with a smile again, because if we have fit you appropriately and the vision is on task, then you're going to have clear vision when you walk out of the office, because we would have you remove the contact lenses at that second visit or the initial visit. At the second visit, usually we would let you go for about 2 weeks. Some patients a little bit sooner than that. It depends on how well you did at that first follow-up visit at day 1, or if you're having any complications, which there are some minor complications that can happen, but nothing that is too detrimental to you wearing the contact lenses. So at the second follow-up, which is about 2 weeks later, we assess the fit. Again, you got that big smile on, no lenses in your eyes, because your vision is sharp and clear and in focus. And then typically I will do a 1-month follow-up and a 3-month follow-up. That is because Dr. Gamble is just like that. It's not mandatory, but I want to make sure that if you leave with this therapy, that you're getting all out of the therapy that you can. So expect to see me 2, 3, 4, maybe 5 times. And all of that is included. If we have to do any remeasuring, if we have to send the lenses out, because there is one that I don't have in my set, you don't come out of pocket again, because all of that is included in the one-time price that you do pay. And after the 3-month visit, there is an annual visit. It just makes sense. We're working with reshaping the cornea, but we do also have to maintain the health of your eyes. So that will be something that we would have to check on. So is orthokeratology, or ortho-K, as you'll sometimes hear us say, is it right for you? Well, we've kind of talked about who are candidates. If you're nearsighted at a certain level, not above a 6, if you have astigmatism, not above a level 2, then definitely this is something to consider. If you want to reduce your risk of premature cataracts, if you want to reduce your risk of retinal detachment, glaucoma, there are definitely studies that show that those issues are higher in patients that are nearsighted, and the higher your nearsightedness, the more of a risk factor for you. And those things are more prevalent in patients that have higher astigmatism. So if you want to reduce those risks, then this might be a procedure that's right for you. If you want to be super active, if you want to be out surfing and you like to ski, Bonnie, you look like a snowboarder to me. If that is what you like, if you are a venture kind of person, then definitely the orthokeratology therapy may work for you. And then finally, it just gives you uninhibited vision. The glasses, which a lot of people look great in their glasses, Miss Betty, Penny, you guys look fabulous. Sometimes they can become a burden for some eyes. And so the ability to see clearly all the way around, that is intriguing to some patients. And so this would be something that you would want to consider. And that is it, guys. Like I said, very brief, super informal, and we are now open for questions. And right, down in the back. No. Yes.
When you put the contacts in, so I'm looking at this as a possibility for my son who's in complete.
Oh, awesome.
So
yes.
if he puts the contacts in at night, can he see out of those too?
Yeah.
So if he puts them in at 7 o'clock at night or whatever, he can still see with them in his eye.
Yes.
Then the second thing, will it slow down at age 16? Will it slow down his eyes getting worse?
Yes. Excellent question. So the two questions, if he puts them in, say at 7 o'clock at night, because he was out roughhousing, doing what he needed to do with sports, will he be able to see? Will he be able to see? Yes. The answer to that question is yes. When the lenses are in, the therapy is complete, you put them in, you can see clearly with them. The second question is an excellent question. The SMART study is one of the studies that's on the forefront of CRT therapy, and it shows that if patients do the therapy, okay, typically we see 0.5 units worth of a shift in the prescription every year in nearsightedness. The SMART study says that can take it down to 0. So what that means in layman's terms is that if you wear the lenses and you wear them for a year, then we can take your progression rate to 0. Okay, and so that's why this therapy is approved for kids as young as 8, because for those kids that have a lot of nearsightedness and their genetics, meaning mom and dad, are setting them up for myopic failure, as I like to call it, this really could be a life-changing event for them. It really could slow down the progression of their nearsightedness. Any other questions?
So you have to put them in and take them out for like a year before you, or then, how does that work?
Right, so that's a good question. So when you come in the first day, you'll put the lenses in. In office, you will see very clearly out of the lenses if the parameters are on track. After you sleep in the lenses and come in the next morning, you will have clarity. The lenses out of your eyes, you will be able to see clearly. Now, how long that time frame for the clarity is during the day for the next day, it depends on how tough your cornea is. Because like I said earlier, it is very resilient, but most corneas will relax enough for the therapy to work the first night, and you can have around 6 hours of clarity the next day.
So how long do you have to keep doing that?
Every night, I like to liken it to a retainer. So after you've had your braces on, you will use a retainer after the braces come off to maintain the shape. So that's pretty much what it is. And you will notice you will start to be able to go 1 day, maybe 2 days. Some people as much as 3 days without wearing your retainer for your eyeball, and you will still have that clarity. But we recommend that you use the lens every night so there's no issue.
But how long do you have to
So this is
that retainer thing?
every night.
It's not permanent.
It is not permanent, yes. It's a temporary, yes ma'am. So you would do it.
It was good for 6 months or?
No, the lenses are good typically for a year, and then we would recheck them after a year. But this is a non-surgical treatment, and so in order to maintain that clarity, you would need to use the contact lens. But you're not buying a contact lens every time you are treating. It's one lens that we would use, and then at the annual visit, we would talk about needing updates or different things like that. But that's an excellent question. I don't want to give the misconception that you do it and it's done. This is a do it and do it scenario. Yes, ma'am. Yes, ma'am.
Insurance or considered like it?
Most insurances do not cover it. It is considered an elective procedure. There are some plans that will give you some funds towards the therapy. They typically don't pay in full, but what we tell patients, check with your carrier. You never know. Sometimes they have these little hidden things on there, but that would be something you would talk to your insurance carrier about, and we can assist with that if you want us to look into it further.
What's the typical cost on that?
So it varies, but around $2,300
Right.
for the procedure. Yeah, around. Sometimes it's a little bit less than that.
For that year.
That's for the whole year. Yeah. Yes, ma'am.
So was I correct in my understanding that you forestated that it could lead to not needing the contacts or the glasses at all at
Yes.
some point?
Not indefinitely. You would have to use the retainer contact lens in order to continue the results.
But as long as it's
Yes.
done,
Mhm.
needing not
Yes.
needing the glasses or contact lenses.
Yes.
Oh, I love it.
Yes, yes, yes. And so that's the selling point. For some people, it is a nuisance. Most patients understand what the process is and the fact that, well, if I do this one thing while I'm sleeping, you're literally sleeping, you're not doing anything, then I don't have the nuisance of my glasses or contacts during the day. But it is something that you will maintain, and we will help you with that maintenance process. Yeah. Those are good questions,
So
guys.
you wake up in the morning and it's clarity, you take them out and it's clarity, and say you end up working a second shift at work or something like that. You better make sure you have your stuff, because just because it's clear till 5 p.m. if you're not planning on getting back home,
Yeah.
right? I mean, 'cause it could, it's like Cinderella needing to hurry.
I know. It's 12:05, it's 12:01. So that is a good question. Like I said, the longer you do the therapy, the longer you can go. But of course, it depends on the eyeball. So to sit here and say, thank you. Yeah, I was about to say, to sit here and say, okay, you look like about a 16-hour person. We can't do that. That's why I like that 1 month and that 3-month follow-up visit, because maybe I can go in and tweak it a little bit to extend your time a little bit. And that we don't know until you get into the lenses. But yeah, so you would need to be prepared with glasses or some sort of additional therapy treatment. Sometimes I will give contact lenses if you're, working a 16-hour day for some reason. I'll say, okay, well, these are some contact lenses you can have just in case you're outside of the window and you don't want to put the hard lenses in. We work with that.
So
Then I saw, I'm sorry, she had a question. Oh, I did? Yes, ma'am. Okay, yes.
So if my son has a football game at night, so could he get up that morning, keep the contacts in until like 10 or 11 o'clock that day, and then take them out?
It's possible.
And then be able to, if he's got
Maintain
like a
to the
12-hour,
evening.
then he could not have to wear.
Right,
Okay.
right.
But he would
right.
be trying to go to school
He
with
would-
contacts in his eye.
Right, right. Now, is that recommended? No. So that's what I said earlier. It's case-by-case scenario. But once I look at him, I can kind of give an idea based on how long he's lasting during the day. He may last the whole day. And we wouldn't even have to intervene with him having to take all of this stuff to school to take the contact lenses out. My goal would be to give you the most longevity as far as the eyes go during the day so that you're not having to do that. But we have to be logical. There are some eyes that may have to do that. And then we play around with options at that point.
How often do you have to replace this lens?
So the lenses are yearly lenses. And so we bring you back in, reassess the fit at that point, and after that time we could talk about, okay, well, you know what, Miss Penny, you're on track, your lenses are still tracking, you're good to go another 6 months and I'll see you back in. Or, we're at a year mark, let's go ahead and make some adjustments, we make some changes, and then we could go from there. So typically it's a year.
Scratch just like contact lenses?
Very difficult for that to happen if you manage them the way that we train you to. Yeah, it is possible, so I can't say it's a no, but it would be very hard to do that. Yeah. Yes, ma'am.
Cost-wise, so we come in and this is a great thing and we do this and we pay however much money, that we need to pay.
Yes, ma'am.
And then we're into it a year and we come in for a visit and you say, okay, well, everything looks good, but I do think you need more contacts. Is it like another $2,300 the next year? Or it's just, but that initial setup is
This initial setup. And like I said, $2,300 is not a firm number, that's just an
Right, it is
approximate. But no, ma'am, usually after that, the fee is so much less because you've already gone through the hard part. And it's sort of like a maintenance at that point. We have to do the health assessment, so that's kind of in there. And then there's a test that has to be repeated, and that charge is included in that annual fee. But after that, it's just the annual fee. It's nothing dramatic. Yeah.
If he was just asking me about this. So
Yeah.
let's say that he gets up the next day, he sees great and whatever. Can he throw his glasses on too? Or probably you can't put your glasses on because you have perfect vision and then your glasses.
Correct. So that would be doubling the visual issue that he had, if that makes sense. So no,
Yeah, so he doesn't even need
he can do it because let me tell you, we have those people that are out there just like, well, let me just test drive. Whoa, he wouldn't be able to see clearly. It would not give him clarity of vision at all. Yeah, but it's not hurting him to just real quick like, oh man, yeah. Good questions. Any other questions? In the back. Yeah.
Not really supposed to ask questions, but
No, go
does the
ahead.
amount of sleep you get in a night affect like how much, like how the contacts work?
Possibly. So if you're getting 3 hours of sleep, that's not enough time for the therapy to work. So 6 is a minimum, is what I tell patients. You have to get at least 6 hours of sleep. Like, you know, you're not going to get full therapeutic treatment if you're not sleeping at least 6 hours. And even with 6 hours, doing that every night, that may or may not be enough. So we would try and get a full 8-hour sleep cycle in. Who does that? But that's the goal. Yes, ma'am. I know somebody already doesn't know.
I know you saw me out of your peripheral vision. However, with the sleep patterns, if your sleep pattern is not one, or if your schedule is not one that allows for you to accomplish the 8 hours of sleep, when you're just laying down resting, is the therapy still working?
So we kind of talked about that earlier in the sense that if you're, it's not so much the sleeping, it's the lens on the eye, if that makes sense. So you could potentially do this during the day. The goal is to do it at night, though. You're laying down, there's gravity that's involved, and so it's best to do it the way that it has been studied, where you're sleeping, you're laying down, eyes are closed on top of the lens, the lid adds a layer of effect to this as well. So that's why we recommend sleeping. But, you know, like in her case, if her son had them on during the day, he's still going to get treatment because hopefully by the time he's using them for sports, he's already in retainer mode.
Absolutely.
And so it would not be detrimental to the functioning. But the goal is when you're sleeping in at night.
So just let me be clear, laying down is okay.
Laying down, sleeping, yes.
Just get her to make a prescription for Ambien.
We got to get Ambien, one of that.
I'm trying to get on here.
Yes,
Yes, ma'am.
yes, 8 hours, yes. Other questions? Any other questions, guys? Anything? Okay, well, that is it. I don't have anything else. I just wanted to let you guys know that we are here for you. We're here for the community. Feel free to give us a call if you have any questions. I have some business cards. We have a couple of coupons, or actually just one coupon that's out right now if you want to take one of those. Tell your friends, tell your family. It's definitely something to at least think about. And I say think more about it, especially in our youngsters and in those that are super active. So if there are no more questions,